65-year-old jewelry store owner Isaac Oanesi has been shot in the chest.
Isaac, keep your arms down for me. Relax. Take care of you. No. Leave it up.
As soon as we get the alarm, we go down to the trauma room and begin to prepare for his arrival.
Over the years, Dr. Jeffrey Abrams has acquired the skills to deal with trauma patients like Isaac. There's no question that every tick of the clock, the likelihood of surviving traumas is one chance for survival, just to get to the operating room. Trauma surgeon Shaki Saad gets the urgent page.
Trauma center is a center that has all these physicians including me on call ready to go.
The cases Dr. Saad sees are always life and death, and this one is an exception.
A long week and ready for the paramedic ambulance to bring the patient. Give me the overview. Dr. going on, bed, Bible table, fellow season. We did 2 logical IVs, a police dressing, and we have the full seats back to copy.
I'm transferring all my stuff over, hanging my IV bags. Before I take my monitoring device off, I allow them to establish theirs. 2, 3.
Thanks, dude.
BP 90/52, pulse 130, 336, like tell breathing.
He looks bad. Right away we know that he's in critical condition.
Display that set of lungs. Vital counts like 6 minutes. We'll go back to send as much full negative as we can get. So, that's it. I am Dr. Saad. We'll be taking you to surgery as soon as we see the opportunities, yes? What is my x-ray thing?
Wonderfully done, sir.
I'll take care of his airway. His vital signs are bad. They wouldn't be reacting that way unless there was significant blood loss.
Because the symptoms just x-ray.
Clear.
When the x-rays come back from the lab, the doctor's worst fears are confirmed. The bullet passed directly through the heart.
All the blood banks, come up very to cause take 6 to the head, and see if there's a bad line for surgery.
Maybe at that point,
Leave it to me. There. I'm sorry, everyone. Leave it to me.
Dr. Michelle Finkel's first patient on a busy day has a delicate problem.
All right. They're open. Not yet. My turn. It's my turn. It's my turn. There. Won't give up. It's my turn. There. Open.
We did it! So I still had my eye on him, and he was going to head on an ultrasound. The call got in, so I can see in
3 freaking hours. That's how long I've been over here. 3 freaking hours. And counting.
That someone else is Mark Harris, whose complaint is knee pain, a symptom not as serious as some of the other patients in the waiting room.
Don't tell me after waiting here.
He's been waiting a long time. He's seen other people going in before him. He doesn't understand why. So I just take a deep breath, and I get ready for somebody to be angry at me. Mr. Harris, how are you? After thank God.
Right. 2 minutes. 3 hours and 5 minutes, I think it is, Sam. For me to see you. Isn't that correct? What about Operation Money?
I'm sorry, it's very busy out there, but I do have to take good care of him now. Can you tell me how long your knee's been hurting?
A few days.
I just try to move on from the frustration. Take a look at it. And once they vent it a little bit, they're usually ready to actually sing.
There we go.
Okay, so just from the pulse. Okay.
Good. Right, good.
I thought that his knee exam was rather benign. My suspicion was he had a small knee sprain, but he was tender enough that I thought he needed an x-ray of his knee. All right, well, I don't know any obvious fracture, but I think he'll probably get an x-ray.
Okay. Well, go ahead.
You can start calling me, although you're sooner better.
Right. Keep rating. Perfect.
Enemies ahead!
I was saying,
I'm sorry, everyone.
did you get a
All right.
ticket for Harris?
My turn!
Okay, he's not going forward.
Give it up, everyone! You're mine! You're mine! All right. Take this! Thanks!
Right. It's a picture.
It's my turn. Go! Have a chance!
Nailed the doggo. It looks like a wooden handle. Okay, sir.
My turn.
This is the
I go
first
where the
Dr.
wind takes me.
Guerrero's orbit. I don't really know how to process this. Serena, the top. Dr. Serena Boscani is a third-year ER resident. Wait, all right. Come take a look.
Nice spot.
She doesn't speak any English. All I know is school.
Enemy sighted! Take him out! It's my turn.
Right.
Leave it to me. They're open.
It's like a What?
Give it up, everyone.
You were telling me you had that in your head for 5 days when you just came to the doctor?
All right.
God, this guy has had this for 5 days.
My turn.
Sitting here not here talking
Leave it to me. My turn.
Well, if there is, how this guy's gonna walk?
My turn.
Okay, don't
Arcus activate.
Leave it to me.
Dr. Serena Boscani, Jeremy
I go where the wind takes me.
All right.
Just getting started.
Doctor.
Enemy sighted! Take him out!
My turn.
It's my turn. Go! There! You're mine!
There's a thin pencil-sized object standing in from his
Give it up, everyone.
It's my turn. Here we go!
All right. It says, how full body critical collectively.
My turn!
The exclamation point is very
Give it up, everyone.
Here we go!
This guy has walked the Zealand.
All right.
Oh, great.
Thanks.
Here we go! It's my turn. My turn. All right. They must win because I'm on our side.
Says it's I don't even please fix it.
You think it might have something to do with that 7-meter ice cream?
Trigger chest. Watch out, Doc. You think we could run? Where'd you come from?
Go! Let's keep moving.
Yay, we're at the end.
Sí, yo soy yo lo hice. Why?
Okay.
Well, we're pretty dumbfounded. For emergency medicine residents and attending that same. You see everything.
He said that he's hearing voices, so he stuck the ice pick in his ear to stop.
Trauma surgeon Dr. Saad is getting ready to take his patient to the operating room. The 65-year-old jewelry store owner was shot directly through the heart. Now, the bullet could be anywhere. He's still alive, but the odds were still extremely against survival. I
Isaac's daughter Tanya is just arrived.
This is a tough one.
Give it up, everyone!
Leave it to me.
Learning
Go! That's a chance. All right. Over there. Go. My turn. My turn. That's a chance. Leave it to me. Over there.
My turn.
My turn. It's my turn. Over there.
Right.
My turn. Leave it to me. You're open.
My turn. Give it up, everyone!
Leave it to me.
Isaac's side finishes his whole arm in a complicated procedure of defending the bullet in Isaac's chest.
Leave it to me.
And
Go.
Wilkins
Have a chance.
My turn. Focus active attack.
It's my turn. Here we go.
Right. Give it up, everyone!
It's my turn. Here we go.
for the blow.
Here we go. Have a chance. Leave it to me. There.
Force up the position.
Go.
So we open
It's my turn. There. My turn. You're on our side.
It's got her time.
I did it! I did it!
Nice.
I didn't tell anybody, I didn't speak to anybody. I was just in my own world. I couldn't believe what was going on. He's a very good person. He has a very good heart. And he deserves to be alive.
The wall hold. His heart is falling apart. The muscle was shredded so it wouldn't hold suture. To do it colloidal. Very good. So good. You have to use pieces of felt to reinforce myocardial tissue and be able to put sutures through it and hold. And during that process, his heart just gave out. Come on, Isaac. Suction.
Doctors Jeremy Orbick and Serena Vascani have just learned the shocking truth as to how an ice pick ended up in the ear of their patient, Manuel Hidalgo.
He was able to stop.
Able to get them. He's actually been hearing voices for last week, and in order to try to suppress the voices, he decided maybe putting an ice pick into his ear and actually hammering it in there himself might be able to suppress these voices. Why did you take it out?
¿Por qué no se lo sacó? ¿Por qué lo hizo?
Porque son los demonios. Eran los demonios, las voces de los demonios. Y cuando me empezó el dolor de cabeza,
By knowing that he did this to himself doesn't make me think of him any less as a victim. He's a victim of psychiatric disorder, so it's just as equally concerning as being mugged, in my opinion.
Okay, he said the voices belonged to demons, and when the headaches began, he stuck it in there and didn't want to take it out so the demons wouldn't escape in his home.
aquí en los hospitales también, que pueden salir, no van a hacer daño, no me van a hacer más daño.
It's okay if he releases them in the hospital.
Okay. What? If you could just excuse us for just a second, we've got plenty of people's spirits in our hospital, and I'm not shocked that another evil spirit may join this hospital at this time.
Dolor de cabeza, por favor. Sáquenlo,
He said he has a...
okay. You almost want to just go get a beer and sit down and talk. How does this happen to this guy? If you don't have time, all right, great, just pick up some of the actions and on this week. While we have to address his psychiatric needs, very much on the back burner. We'll get to it. But right now, he just have that many needs. Fíjate, ya se lo dije la verdad, por favor.
start counting now, but it shouldn't be very long, really.
Wait. That's what I'm doing good at. Dr. Michelle Finkel's patient with knee pain, Mark Harris, has vanished.
Where did he go? He's gone, and his wheelchair's gone. We're a little bit confused. I'm sure he's just a radiologist.
Let me go check with him.
The resident himself went over to X-ray, and Mr. Harris isn't there. He hasn't been there yet, or I'm going to get in real trouble.
You know, he's probably okay. Suppose there's no here.
Oh, can't look off. Alright, Dr. Fraser.
No.
Check with him next. I'll go to reception. Mr. Harris was already angry at being waited so long. I didn't see him as doing anything that would delay his care. He wasn't in another patient room. We have a couple of waiting rooms. He wasn't in any of the waiting rooms. There are all these other people waiting, and many of them are staring at us as we're looking for him or talking about where to look for him next.
You have an idea?
I checked the X-ray, I checked in his room. How bad?
Like your wheelchair joyriding kind of guy?
He just sounds like Toddy good guy.
Uh-oh. You may want to hide right now.
Could you explain what I just heard on the loudspeaker? Did we lose a patient? I've never lost a patient before. We always know where our patients are.
Manuel Hidalgo has an 11-centimeter ice pick lodged in his head. What's even more astounding is that he put it there himself.
It's cross-sectional. Should give us the best picture.
But Dr. Serena Boscani and Jeremy Orpik don't have time to be stunned.
Right now in the emergency room, our primary concern is of this swollen body, which is going raised by all these incredibly important vessels in the neck and in the head.
Called the eardrums in front. That's right. Take a look. That's amazing. His vital structures. If he went a little bit more posterior towards the back, he would have likely entered into his brain itself. If he had gone forward or lower down, he would have entered his spinal cord, leaving him paralyzed and likely to die.
Completely in his head. Nothing to do.
Call Dr. Rowe as well.
Where there's smoke, there must be fire. Yeah. Kitchen's way through all. Look why. There were crowds gathered and kind of wanted to see his entrance. It's remarkable how, it's fortunate, it's the wrong word, how untouched the major vasculature, potential neurosurgical complications that this patient were.
Mr. Hidalgo, the eardrum growth specialist and the neurosurgeon, they're here to take a look at your ear.
We're sort of not sure initially whether that should be eardrum strokes case to remove this whole body,
Or whether neurosurgery should be handled, or both. Oh, what a character.
Where's the patient?
The mountain lion is easily capable of crushing someone's throat. We didn't really know what we were going to see or how that was going to be.
Having any pain at all?
No, doctor. Any shortness of breath?
No.
Any nausea, vomiting, diarrhea, any cramping?
No.
This woman is definitely going to be shocked.
That's what's happening to me.
She fell right into a Texas bug.
This child has over 1,000 splinters and thorns all over her body.
These are the untold stories of the ER.
It's an ER that doctors never talk about. She was belligerent, violent, highly agitated.
I wish you could have seen the band.
I've got to worry about not only my patient, but the family as well.
Feel better, we could go back to the party.
The family's not acting the way I expected to. You might feel more comfortable waiting outside while we do this.
No, I'm not going to. everywhere.
That adds to my workload.
Should we plan that party for last week?
Birthday party gone bad.
I went bed to bed to bed in the emergency department. This is looking more and more like suicide poisoning.
2 more on trips.
2 more from the birthday party?
These are the stories of the ER doctors never talk about.
How am I going to get this guy up to the intensive care unit? He's just too big.
You sure it was a rattlesnake?
Ralph was under the impression that because he would drink the venom, that he was immune to snake venom.
Blood shoot 8 feet across the brain.
I just found out that
Why was this guy not telling me the story? Why wasn't he being straight with me from the beginning?
these are the ones I'll never forget.
It's only a matter of seconds.
And then you realize this person,
Lives or dies,
Because of me. These are real stories.
told by the real doctors who lived them. What are you calling about? A snake bite?
A snake bit him. I don't know what to do. I don't know what to do.
When you're dealing with snake bites, time is of the essence.
Not bad. But I don't think I can manage much more than
The
this.
more time that venom is on
I
board,
guess I
the more
should just be
destruction
grateful
it
I was
does.
able to pass the beginner examination at all. Better do some studying. It sounds like this is going to be a busy week. What with
Ralph
an ominous
Prado was a
practical
very
exam
unusual
looming over us.
profession. He is a snake charmer in the circus.
I do have that radio
You
from
think that
George
caused him a
here.
lot of alarm because he worked with him on a routine basis in his circus
We
act.
had that Orbital radio back home, too. Never
Dr.
knew they
Sean
made them this
Bush knows
small,
how
though.
lethal snake venom can be. He acquired his first snake from his
Let's
grandfather
see.
at age 5,
Which
and now
station
he's
is
2
Radio
dozen as
Trista?
pets and research subjects.
Ah,
Let's get
there
him on
we
a
go.
trip.
I think snakes are one of the most amazing creatures on the planet.
It's 9 p.m. and
They
you're
exhibit
listening
very
to Radio
unusual,
Trista.
very poorly understood behavior. There's all kinds of
Welcome,
amazement
welcome.
about
Don't touch
snakes,
that
and I
dial,
share
listeners.
that
You found the
to
right place
almost
to be tonight.
abnormal proportions.
It was
time
while
for the
working
start
with
of a brand
poisonous
new
snakes
program
that
here on
Ralph
Radio
began
Trista,
keeping them at
coming at you
home as
promptly every
pets.
Sunday.
The snake had gotten loose behind the
I call it
sofa, and he
Abentine
reached
after the
back
word
and
for
tried to
evening.
pull it out. Normally snakes strike and release, and this snake hung on for
Might be a little
15
cliched,
seconds.
but
on the
sometimes
fence
simple
the
is
whole
best,
time.
right?
Ralph's
Cliches are
throat is
cliches
so
for a reason,
swollen by
after
his
all.
body's reaction to the venom that paramedics had
Anyway, my
difficulty
name is
inserting
Misty,
a
and I'll
reed
be
into
your
it.
host.
Okay, they got in his esophagus. He's not getting the air. We're gonna have to reinnovate.
Hopefully, I'll get to feature some famous
By the
guests
time he
at
gets
some
to the
point, so be
emergency
sure you
department,
tune in every week or you might miss them.
You know, she's got a pretty nice voice.
It's in the esophagus. We have to take the tube out.
This might be good to leave on in the background while I'm working.
Okay, I got the floors. Yep, there we go. Now,
I hope life has been treating all of you well this month as we slowly near the end of April.
Ralph, is this a local snake?
Here in Trista, the beautiful Lido flowers have passed their peak and begun to wilt.
I'm trying to help you, okay?
His body is having
But
a
wilting
reaction
flowers
of
are
an
beautiful
allergic
in their own
reaction.
way, as they serve to remind us just how fleeting this existence truly is.
Take it easy, Ralph. Okay.
I'm sure many of our listeners are students, busy with the challenges of adjusting. But what harm is there in taking a moment to admire nature
When
every
the
now and
snake
again?
fang
It's good for
punctures
what ails
bleeding
you, I
in,
say.
bleeding his nose, his GI tract, bleeding out of everywhere.
Yeah, this guy's really sick.
I've dealt with hundreds of snake bites, and I've never seen someone sick.
Okay, let's get your practical exam started, shall we? To be completely clear from the outset, this exam
As
is
a
about
licensed
more
pilot,
than just
Dr.
testing your
Ralph
physical
Steele
strength
knows
and
that disregard
stamina.
for safety and overconfidence can lead to disaster.
It's designed to hone in on how capable you
It's a
are of
lesson that
making
also applies
strategic
to the
combat
ER.
decisions on the fly.
This is a day that I have never forgotten.
Defeating your opponent quickly is a good thing, certainly, but it won't be enough to score you high marks here.
Huh. Interesting.
Rob Brennan, a 30-year-old
So we're going to have to use our
paralegal,
heads
is the
for this
victim
one,
of an
huh?
assault. He just moved to the city a year ago from a small rural town.
You'll see.
So services can be
Anyway,
fire.
let's get this month's exam started, shall we?
Steve Wilson was a full
Reedy, Elliot,
You saw this guy.
you're up
He had a
first.
couple of hits
Please
to his
step forward.
face, a little bit of a black eye. This guy is not bad.
Got it.
Hi, Rob. Dr. Steele. Actually, Rob. Same name. Looks like we got the worst of it here.
All right, then.
I'm just kidding.
Here we go.
You know, I've been on receiving end a few punches in my day. Well, stay look.
What's that?
He tells me that he was hit with
A
a
monster?
fist, kicked, and
No.
beat
I'm not
up
sensing any life
by
coming from it at all.
somebody who he knew.
That's right. Think of it like a scarecrow.
This
Only
guy
it's
is
a
wasting
moving
resources.
scarecrow, I guess.
But
Either way,
you
it's
never
not
know
alive.
until you get into it.
I set its parameters fairly high, though,
As a
so it
doctor,
is formidable.
sometimes
But if you give it
can't
your
trust
all,
your
I'm
first
confident
gut
you can
or
beat
your
it.
first impression, because sometimes these people are here.
Make good
for
use of
very
your
valid
Arcus' combat link
Sometimes
abilities, for example,
it's so
and I
fun.
bet it'll be a piece of cake. Hint, hint.
So that's what you're
The
playing.
circus performer Ralph Prado, who was bitten by one of his poisonous pet snakes, time is his greatest enemy.
All right, begin.
Enemy sight! Take him out! Here we go!
Venom destroys
Leave it to me.
tissue. He does that by testing. So he gets Venom on board, so he can stop that
Here we go.
irreversible mucus.
It's my turn.
But while it's on, it's just tearing up the tissue.
Ralph Prado thought he was immune because he had been milking his snakes and drinking the venom. He had been bitten several times before and always recovered. But in fact, his bite is making him more allergic to the venom. Now the poison is spreading through his helpless body. He can't tell the doctors what kind of snake bit him.
Leave it to me.
So the doctor was to find out for sure. He's made an educated guess that it's a local western rattlesnake.
Leave it to me. They're open. My turn. Leave it to me. There.
My turn.
Here we go. Okay. Safe for now.
If he's wrong, Ralph will die.
We won.
Meanwhile,
Don't
Dr.
know
Rob
how,
Steele
though.
has a feeling in his gut that something isn't on the up and up with his 30-year-old paralegal
Not bad.
patient.
So I'm
Not
as
bad
nice
at all.
polite as I can be with this guy.
Excellent use of
I
combat
start
links, too.
hearing his
Seems like the
story.
practice you got in the old schoolhouse really paid off.
Serious here. You want to tell me what happened?
It just may have.
Some guy I know.
Oh?
We got in a fight.
Have those three been training in
I'm not very
secret?
impressed. And to be honest, I'm not that sympathetic with this
All
guy.
right.
I'm
On
thinking
to
this
the second
guy,
group.
you just got in a fight, you lost your fight,
Laura,
but
Emma, Eustace.
I mean,
Come
a lot of
forward.
people feel busy. But then he tells me that he's really short breath, which kind of sets up a little red flag for me. Any idea what might have precipitated this? So I start trying to ask him, well, why are you so
That
short
was
breath?
tougher than I thought it would be.
And he doesn't really want to come
Seems
forward
like
with the
combat
information.
links
He's
are the
not
key to
real
fighting it
talkative.
effectively, though.
Look, Rob, I'm trying to help you out here, okay? But you got
That's
to, part
rather
of being an ER
unfortunate.
doctor is that you have to develop a partnership with the patient.
Instructor,
You have to
may
develop
I ask a
bonds
question?
very quickly, and you have to trust what
What
they're
exactly
telling
was that
you. But this
marionette we
patient
just
just
lost?
isn't telling me what's going on. I know there's something else going
Yeah,
on.
that
They're
thing
not
was
telling me.
weird.
Tell me about it.
Machine, maybe? Never seen anything else
I
like
looked
it.
up at the heart monitor that we have that's right there.
Just a little something I got roped into
He's
working
talking,
with a
right?
while
This
back.
guy's going at 140 beats a minute.
I'd rather not use it if I don't have to, but I can't deny it serves as
The
a valuable
normal rate
function.
in a healthy
And it's
man,
rather
Rob's age,
customizable, too.
is half that.
Rob, he's getting attacked. Okay.
I mean, it did its job quite well during our test, didn't it?
Stay with
So there you go.
Okay, we gotta come here.
I get the feeling there's a whole lot she'd rather not tell us.
Anyway, that brings this month's practical exam to an end.
I look up at the monitor and I see
But
that
as you might recall, I told you I had a big announcement for you today, too. Are you all ready to hear what it
I know
is?
something very serious is going
I'll
on.
give you a hint.
Dr.
It's
Steele
about a
can't
special
keep
part of
moments
Class
away from
7's
sending his
curriculum.
patient home, and now the man is near death.
Give up? It's really bugging you now, isn't it?
Ralph Prado is
Well,
quite a
I'll
character,
come
a
clean.
circus performer who is a favorite of kids and adults alike. But now he's dying of a snake bite, and Dr. Sean Bush is doing all
The
he
special
can to keep
task
him
you're
alive.
about to be assigned is none other
Okay, let's not
than
get any venom, Mike. Let's get the program.
a field study.
Hopefully he won't suffer any permanent
Field study?
Oh, I don't like the sound of this one bit.
With no time to identify whether the snake was an exotic breed or
You'll
a
be
more
split
common
into two
domestic
groups,
species,
A and
Dr.
B,
Bush
and
begins
each
to
sent to a
administer
different location.
antivenom. But the hospital only has antivenom that will treat the most common North American snake bites.
And while you're there, you'll be given a number of tasks to complete.
We give him his first dose of
Doesn't that sound
antivenom,
like fun?
but he doesn't respond at all. It's as if nothing has
We
been
only
given.
just got to the academy, and we're already being sent somewhere else.
That's not going to be enough. Let's get him 6 more.
Will you not be coming with us, instructor?
Here, you
Oh,
take
of course not. It'd be much too easy for you if I were there to bail you out every time the waters of life came seeping in.
The domestic antivenom is not working.
You've gotta
It's
be
now
cruel to
more
be
critical
kind
than ever
and
that
all
Dr.
that.
Bush identify this snake.
we can give him some help here.
I sent the sheriff out to retrieve that snake and bring it back to me so I can identify the snake. And no.
Well, I'm certainly not opposed to a challenge if it allows me to advance my training.
Instructor Valentine,
You got an FFP?
where exactly will we be going, and when?
I would repeat these parameters and look, he's still doing worse. I'll say, let's double it again.
Ah, yes, about that.
Before you know, we've given him almost 60 miles of antivenom.
As I said, you'll be split into two groups, A and B.
Dr. Bush marks Ralph's arm to monitor the
Each
advancement
of
of
you,
the
please
poison
come
now
forward and
threatening his
take one of
patient's
these
vital
to see how the
systems.
groups have been divided
While
and
we're
where
waiting for the
each is
snake to
being
come
sent.
in, we're continuing to treat him like a rattlesnake bite, one of our typical rattlesnakes. But if it was exotic, then the antivenom wouldn't work, so it would be futile. So we're just wondering if we're even doing the right thing.
Well, these are certainly some interesting groupings.
Dr. Michael Wolf is
Celtic
known
and
around the ER as a jokester,
both in
but today
Erebonia?
he's going to wonder if the joke isn't on him.
Yeah, Keldrick's a market town on the east
I was
side of the
resident
Empire.
here, sitting around with the other residents, the nurses, the
And
techs.
Parm is situated in
We're
the
all
deep
just,
south.
you
It's
know,
known for its
crossword puzzle
spinners.
type thing, reading various books.
All that way? How irritating.
I'm less worried about where we're going than the utter lack of sense that led to these groupings. Unbelievable.
Hassan
You'll be
Kumar
leaving this
drives a cab
weekend,
12
and we'll be
hours a
out in
day.
the field for 2 days' time.
Hey, get no beat, kid, okay?
Your means of reaching your respective locations will, of
Arrived from
course, be
Pakistan
by
2
train.
years ago.
He's having a baby.
And this is his first
So
child.
do make sure you're thoroughly prepared, rested, and rearing to go.
I stare in disbelief as if your wife is there.
Oh, yeah. Why didn't you drive right here?
Thank you for everything.
So when there's a sign around here, part of me wanted to insult them. They're like, what were you thinking? And then part of me is thinking, all right, you know, you're in an emergency position, you're in a situation, you have to figure out the best way to deal with it.
All right, I'm gonna go. You guys stay.
I still haven't been able to apologize to her.
Dr. Wolf now has to get her into the hospital as quickly as possible.
And next time your wife delivers, drive right up to the front. Can you tell him I told you? Yeah, I did. Thank you.
We can't exactly avoid working with one another when we're in the same group. I'm sure this is pretty awkward for her too, so I really want to say
In
something.
just a few seconds,
When am I
Dr.
going to get
Robert
the
Steele's
chance?
patient has slid from stable to barely alive. Now it's a race to figure out why.
Morning, Elisa.
I take a shirt off.
Morning.
Fine. There's nothing wrong there.
You're a...
But you can
early?
just see, just on
We don't
where
have to be here for
labs
another
are,
20
just
minutes,
kind of on
you
the
know.
side, you can see a bandage.
Well, the same goes for
Strip
you.
the bandage off. You can see this guy has a stab wound right there.
What time did you wake up?
Around 5, I think?
I can't really understand why his
Though
story
I
isn't
always try
jiving
to be up
with
by
the
then.
injuries that I'm seeing. But I have to do something right
Really? Morning practice? You haven't joined any clubs, have you? So I
He has
guess.
so much air in his chest, and it's actually shifting.
How does she
his
know
heart,
that?
All of the structures, the aorta, everything else,
over to the other side.
No, it's just a
like
force of habit.
So
I've
there's
gotten
hard
used to waking
trying
up early.
pump against the key toes, and it doesn't work.
You're in the lacrosse club, right? So I'm guessing you do have to deal with morning practice sometimes.
I have to act now.
Yeah,
And if I don't,
twice a week,
it'll be
apparently.
dead in the next several seconds.
I'm really sorry. Why are you apologizing?
The young doctor has a few seconds to perform a procedure he's only read about in
That
medical
was
books.
certainly interesting.
Here we go.
But no, I really am sorry. I knew it was just an unfortunate accident
Dr.
from the very
Steele
beginning.
pierces his
I
patient's
was on
chest
top
to
of you.
reduce the pressure that's building
You
up
gotta mix
inside.
Alright, I'll accept.
I grab a scalpel.
I kind of lost my head, and before I knew it, I'd slapped you.
As
And
soon
you
as
had your
I
hands out like you were
make that
trying to catch
incision,
me, right?
I go through
So
the
if
chest
anything,
wall,
I should be
and it's
thanking
like
you.
a pop, explode.
Don't worry about it. That trapdoor was obviously designed so we wouldn't get hurt from the fall. If I hadn't tried to play the hero, I wouldn't have been pinned under you,
Dr.
and none
Rob
of this would
Steele
have
has to
happened.
relieve a tension pneumothorax in a young paralegal named Rob Brenham.
There's no way you could have known that,
I'm
though.
covered from head to toe in blood.
No matter how you look at it, I'm the one in the wrong here.
As the air decompresses out of his chest. Blood shoots 8 feet across the
So,
room.
thank you for
And
trying
I
to
can
protect
feel
me.
stickiness of the
And
blood.
sorry again.
Now, thick coppery metal smell of blood.
No, it's... I mean, you're... well...
The patient is getting better. His heart rate is coming down. His
Sorry,
blood
I
pressure is coming
have
up.
trouble with these kinds
He
of things.
regains consciousness.
My little sister is always getting on my case for being so easily flustered.
Carl's birthday.
Oh,
You know
you're the younger
what
sister?
birthday? If it was the weekend, so I can have a day off.
That's a question for another time.
And
I think I'm the
I
same
said
way.
it was every weekend.
I've been
And-
trying to apologize for the past
No, I'm
couple
stuck here with
weeks
you.
now.
I should be gone.
But every time I set my mind to it, I always just wound up avoiding you.
Dr. Steele inserts a tube through the incision
Really?
and starts suctioning the air from the chest cavity. This allows
You did
the
try to help me
left
out in
lung
class
inflate.
last week, though.
Got that? All right. With all
Oh, you
signs
noticed.
now reading normal, the patient
I was
is
hoping
wheeled
that
to
would
another
give us a
floor
chance
to
to
recover.
Though you didn't need my help in the end, so it didn't really do much good.
This is one of the highest moments in my life. I have just saved this guy's life.
I still
This
appreciate
guy
the
cheated
thought.
on me, Ring of death, and I have brought him back.
Oh, well, I'm glad to hear it.
Saving a life, turning forward. That's
anyway.
what all the sleepless nights are for.
We've safely established that what happened wasn't your fault, but the result of it is another issue entirely.
Myself, all cleaned up. I am feeling proud.
Result? What are we talking about now?
Oh, come on! You have to know what I mean.
Dr. Michael
This is still
Wolf
in
has
regards
seen
to the
nervous
accident
stats
in the
before,
old schoolhouse,
but he
right?
has never seen one as confused
Yes,
as this immigrant
specifically
taxi
the part
driver
where your face
who
ended
can't
up
even
right
find a
in my...
parking space in a totally empty parking lot.
You know, and I forbid you from ever thinking about that, ever. Forget it ever happened.
Medical problems?
Are we clear?
You could see through the windshield
yes,
from
perfectly.
dozens of yards away that she had that expression that women tend to get later
Trying
on.
to avoid thinking about it is just going to make it harder to forget, though. Huh?
I'm John, Dr. Walsh.
Oh, good morning.
Before you're listening, check the store for a second, okay?
Good morning. A lovely day, isn't it?
No, I'm sorry.
You two certainly got here early.
Organization. Traits that come in handy. in
Looks
the
like you
ER.
finally managed to make up, too.
Everything magical comes through the ER door.
Well,
Yeah, I think we're on good terms now. Thanks for your concern.
And paramedics dragging somebody's inside
I'm
out
glad to hear it.
with an enormous person.
It's been a bit trying watching the two of you simmer these past weeks.
This is...
And I know Elisa has been desperate to apologize for her behavior this whole time.
The paramedics found 28-year-old
Whoa,
Melissa
whoa!
Royal bedridden and barely able to move. It took a team of 8
that's
firefighters
only
and a
because
special
I thought it would be
double-wide
awkward for
ambulance
two
in
people who
this
aren't
fog
talking to work together in the
with
same
no help from
room.
his mother.
Don't go getting the wrong idea
Joe
or
Rouse
anything.
lives with his mother. She's the one that's
Whatever you say.
while he's in his condition. Once he started breathing badly,
Well, as long as the two of you have smoothed things over, that's what's important.
Now that we're all here, let's say we head out. The train's not due for a while longer, so this could be a good opportunity. We can swing by a few shops and stock up on supplies before heading to the station.
Cardiac arrest. They're running out of time. They must get into the ICU now. The first question you
The
ask
Academy's facilities are supposed to be open early today, too.
Oh, that's perfect. We can make use of the engineering club's facilities before we head out, too.
Shall we depart then?
Come on, guys.
The thing that's going to save this guy's life is to get some oxygen in his lungs and get it there fast. That means I need to intubate him and put a tube down into his lungs and introduce the oxygen.
Little more. Try to there. Try it.
This is no normal intubation. It's a bunch of wrestling around that takes finding the right position, and you don't have that time. It's got to happen now.
Okay, we're in.
He is so big that his heart can't possibly pump all that blood through all that body. This guy goes into heart failure. There's a risk of dying right now.
All right, we're gonna get close, guys. Start CPR, please. 1, 2, 3, next. All right, hey guys. All right, we have to clear all this out here. Right now. All right, guys, go.
To get through the treatment room doors, we had to tip the mattress up a little bit and not have the fellow fall out. That's how big he was.
All right. Continue CPR.
All right. I didn't have the answer as to how we were going to get this gentleman up to the intensive care. That's where we could say we're going to save his life. But we couldn't back it. Dr. Sean Bush's snakebite patient is in critical condition and may not survive. Yesterday, Ralph Prado was wearing a turban and serenading the snakes, and today he has been bitten by one of his own pets. Now the sheriff is on his way to Ralph's house, hoping to find out exactly what kind of snake bit him.
What are you doing?
Police get there in time to interrupt the neighbor of Ralph's, who is destroying the snake. So the sheriff shot the snake in the head, then put the snake out of its misery.
Zero advised, hospital, we've got the snake, I'll be around 10 minutes ETA. Come on. Alright, come on. This one was my grandfather.
No, not yet. Yeah. Brings the snake in, and immediately I know it's a Southern Pacific rattlesnake. Although a Southern Pacific rattler is a domestic snake, the only antivenom Dr. Bush has on hand may not work, but he has no choice but to administer the antivenom and hope for the best.
we went ahead and switched into full gear. We started really mixing the anti-venom. Pharmacy wasn't mixing it fast enough, so I started grabbing half of those vials and mixing it myself. The way you mix it is you take the anti-venom that come in vials, it's dried, have it reconstituted.
Rub it between your hands. You just gotta make sure you don't do it too fast so you don't get any bubbles, because you won't be able to.
We needed to get this stuff in fast to save this man's life.
His vitals are all over the place. I can't even get a pulse.
Every system is affected. His kidneys are affected, his GI tract. We're worried that he could have injury to his brain.
With Ralph's system not responding to the antivenom, he continues to deteriorate.
Can't believe he's not responding.
He is given little chance for survival. Dr. Rob Steele is feeling great about saving Rob Brenham's life, but his feelings of joy are about to end.
Why was this guy not telling me the story? Why wasn't he being straight with me from the beginning? Rob? How are you? How you feeling? I gotta ask, why didn't you tell me you'd been stabbed? I mean, I don't get it. My boyfriend. He beat me up.
I just found out that I'm HIV positive.
And HIV positive?
When I told him, he just went crazy. That's when he stabbed me.
And that will not something. Dr. Steele could become infected himself by having that HIV-tainted blood in his eyes.
Snakebite victim Ralph Prado shows no signs of responding to the massive amounts of antivenom he's already received.
Dr. Bush is now concerned that the poison may be causing hemorrhage in his brain. The amount of antivenom Ralph receives reaches record doses.
I want to see how he reacts.
That increasing the brain can cause irreversible damage, including brain death.
Let's get him on a drip, then get him upstairs for a CAT scan.
Luis Arroyo has 3 factors threatening his life. He weighs 600 pounds, he's in cardiac arrest, and Dr. Paul Castillo can't find a way to get him to the ICU.
This poor guy doesn't fit on a gurney. He doesn't fit on a bed. We had to resuscitate him right on the floor. On the inside mattress. I'm sitting here thinking, how am I going to get this guy up to the intensive care unit? He's just too big.
So,
Expectant mother Jaya is in labor, but she beats up regularly. All Dr. Bush can do is wait and see if Ralph has the will to survive. A grossly obese patient needs immediate care to save his life. But the ER staff has no idea how to move him to the ICU.
So I remembered I saw a show in which a veterinarian used a large animal transport backboard to move large animals onto the operating table. Continue CPR.
Right there, hold on. Hey, let's bring your wall seat, please. Okay, on three. 1, 2, 3. Good. All right, guys.
We still needed about 8 guys to get around the edge of this backboard.
Hey guys, play it safe. We're all on set. Okay, 1, 2, 3, let's start this. Okay, 1, 2, 3, lift. Over here, we got it over here. All right. Okay, go to a tight spot here. Hold on.
Jaya Kumar is now just moments away from giving birth. Dr. Wolf still doesn't know how he's going to get her to the ER in time. Working in the emergency department, you get to know each other well. You know when someone says things a certain way, all right, we better just do it, we'll find out the details later. So it's one of those situations where I said, just bring it, and they knew, all right, for whatever reason, you have to just bring it.
All right. I think we're all collected. She said, all right, forget it. Let's go. I think we were also pumped with adrenaline that we were going too fast at first. She was rattling. I was trying to calculate in my head, well, how long is it going to take to get up to labor and delivery? It's just on the 4th floor. It must be 30 seconds. That's it. Number 4. Okay, almost there. It's at that point that I look down and see the baby crown. You see the back of the baby's head. Look this. At that moment, I wasn't sure if it was all with it. And it's the right decision. These are the stories of the ER doctors never talk about. His brain understand. So right now, Daniel is the most critically ill patient in the hospital. When I take you upstairs, we'll get you prepped for reassessment surgery, okay? Absolutely not. Oh my god, I just killed this guy. These are the ones I'll never forget.
It's only a matter of seconds.
And then you realize this person
Lives or dies.
because of me. These are real stories.
Told by the real doctors who live them.
Emergency physicians who are pure adrenaline junkies.
The Ministry of Railways wishes to thank all passengers for their patronage. This transcontinental train is bound for Crossbound.
Dr. John Milne is working alongside trauma surgeon
The next
Dr.
stop
Dr.
is
Arnold. He's
Caldic.
about to have the most unusual case of his career.
We all carry pagers. Often if we're in a group, especially on route.
Passengers traveling to
Pagers out, all
Berea
of them
Yard.
together and
Please change trains at
Most
this
often,
stop.
the gunshot wound or car crash. On this particular day, it said arm versus lawnmower. Arm versus lawnmower. A lawnmower? Is this some kind of joke? As I look at the pager, you try to imagine what this possibly could be. And how can somebody get their arm into a lawnmower?
Help now, the city got 10 stuck in the lawnmower.
Right here.
Bleeding's controlled for now, but we gotta get him in.
Swing around. Where's the hand?
The thing that surprised me most is how calm he was. There's no panic. There's no anxiousness. That was the most frightening thing about it. Was just how calm he actually was.
Let's try to do something for the pain.
It seems like a really relaxing little town, though there are a lot more people here than I expected.
How can a guy cut his hand off and not have any pain at all?
I imagine they've come for the Grand
What's
Market.
your name, sir?
Even merchants from other countries regularly come to see it.
Would you like to tell me what happened?
Sounds like this place is as popular with the tourists as the capital then, but for a whole different set of reasons.
Oh, a parent that I'm not sure their son is going to live because I reflect
Caldic's
on my
also
family.
widely renowned for their local beer, which they make
To have
using
someone
rye.
say the same thing about my children.
But you're all still minors, so I'm the only one here who gets to drink it.
Are you trying to make us jealous?
We don't really care, you know.
Anyway, let me show you to the inn. It's, right over there.
Okay. Let's go.
Well, well, I hadn't expected to see the Purple Lightning herself in such a quaint little town. And the chicks with her seem like an interesting lot, too. No time for that now. I have more pressing matters to attend
Something with their spot. You have to listen to that? Stop.
And I think back to my brother,